revolutionizing smiles with the all-on-4 dental implant-supported prosthesis. In the realm of restorative dentistry, the all-on-4 dental implant-supported prosthesis has emerged as a transformative solution for edentulous patients, those who have lost all their teeth in one or both arches. This innovative technique offers a fixed, long-lasting, and aesthetically pleasing alternative to traditional dentures, dramatically improving quality of life, oral function, and confidence. What is an all-on-4 prosthesis? The all-on-4 technique is a surgical and prosthetic concept that allows for the rehabilitation of an edentulous arch using only 4 strategically placed dental implants. Introduced in the late 1990s by Portuguese dentist Dr. Paulo Malo, this method revolutionized full arch rehabilitation by reducing the need for bone grafting, shortening treatment time, and lowering overall costs. A prosthesis is typically a full arch fixed bridge anchored to these 4 implants. The implants are placed in the anterior portion of the jaw, where bone density is usually higher, with 2 placed vertically in the front and 2 placed at a 30 to 45 degree angle in the posterior. This angulation allows for better load distribution and stability, even in patients with moderate bone resorption. Advantages of all-on-4. 1. Immediate function. One of the most remarkable advantages of the all-on-4 system is that it often allows for immediate loading of the prosthesis. Patients can walk out of the clinic on the same day with a fixed, functional set of teeth, an option known as teeth in a day. 2. Avoidance of bone grafting. Traditional full-arch implants often require bone grafting to compensate for bone loss, especially in the posterior jaw. All-on-4's angled implant design often eliminates the need for such procedures, simplifying treatment and reducing healing time. 3. Cost-effective. Using only 4 implants reduces material and surgical costs. It's a more affordable solution compared to placing 6 or 8 implants for a similar restoration. 4. Aesthetic and functional. These prostheses are designed to mimic the natural appearance of teeth and gums, restoring both facial structure and oral function. Patients can enjoy improved speech, the ability to eat most foods, and enhanced self-esteem. PV. Stabilidad y durabilidad. When properly maintained, all-on-4 restorations can last many years. The implants integrate with the jawbone through osseointegration, creating a solid foundation for the prosthesis. Indications and patient selection. The ideal candidate for an all-on-4 prosthesis is an edentulous patient or one with terminal dentition, teeth that are failing due to decay, periodontal disease, or trauma, with sufficient bone in the anterior maxilla or mandible. However, thorough evaluation is essential. This includes clinical examination, 3D imaging, CBCT scans, assessment of bone quality and volume, medical history review to rule out contraindications like uncontrolled diabetes, smoking, or bisphosphonate use. Patients must also be committed to maintaining oral hygiene and attending follow-up appointments to ensure the longevity of their prosthesis.